I'm Neal Barnard. I'm the head of a group called the Physicians Committee for Responsible Medicine. We promote good nutrition, preventive medicine, keeping people healthy. I'm also on the faculty of the George Washington University School of Medicine. So many people think about breast cancer as find it on a mammogram or on screening and then treat it. But there's something before all that, and that's what can we do with our diet and our lifestyle to try to have this cancer never happen. So what can we do to reduce our risk? And it turns out that there are some steps that are remarkably simple for doing exactly that. One of the most important steps really is a plant-based diet. And that's good for two reasons. The first reason is what's in it. Vegetables and fruits are loaded with vitamins and fiber, other things that can really fight cancer, stop cancer from starting in the first place. The other reason is what's not in it. All the fat and cholesterol that's bad for the heart, these are also things that are bad from the standpoint of cancer. There are carcinogens that form when meat is cooked. Well, on a plant-based diet, those are gone. Up until now, doctors really haven't been focusing so much on it. And they might have been forgiven for that because not so many years ago, what we know today wasn't so clear. But now it is clear. We know that if bacon is your breakfast, your risk of breast cancer is higher than if a nice bowl of oatmeal with cinnamon and raisins were your breakfast. When we think about the foods that we want to include in our diet, I first say, think about color. And so if we're having carrots, that orange color in the carrot is beta carotene, an antioxidant. Tomatoes or watermelon, that red color is lycopene. That's also a powerful antioxidant. Antioxidant can be thought of as a cancer fighter. There are some surprising foods. Soy products like soy milk or tofu. In the past, people thought, well, maybe they would increase cancer risk. It turns out the opposite is true. Women who consume the most soy milk or tofu or other typical soy products actually have about 30% less risk of breast cancer compared to other women. And after breast cancer diagnosis, a woman was treated for it, and she's hoping it never comes back. If she consumes more soy products, she has about a 30% less risk of her cancer ever coming back. You don't have to have soy, but it seems to help against cancer. 1 in 8 American women is going to get breast cancer at some point in her lifetime. Now, the statistics were going up and up and up and up until about the year 2000, and now they're sort of holding steady or coming down a little bit. But we are nowhere where we need to be. Where we need to be is 0. We're not there. We have all kinds of ways of finding cancer, through mammography or even more sophisticated scanning methods. We have all kinds of ways of treating it. But the big problem is that the factors that are causing this to start in the first place are not changing, or they're sure not changing enough. People are not eating in a healthier way. That just hasn't changed. And if you turn on the TV, half the commercials are for snack foods. And if you look at what kids are eating, junk food, fast food, all kinds of stuff. They have diets based on beef, poultry, cheese. All of these things are promoting the problem. They're not fighting the problem. Up until relatively recently, this was a problem in the Western world. This was an American problem. Maybe Western Europe, maybe Australia. But what started happening when the fast food chains started going to Japan and China and other places where they didn't really have much breast cancer before, they started to get it too. And in Japanese women who would stop their traditional diet, which was really a rice-based diet more than anything else, and they started to say, let's have burgers, let's have chicken, let's have dairy products, their breast cancer rates skyrocketed. If a woman has cancer, she really needs good information. She's going to get some good information from her doctor, but I think we should be open-minded. I think we should really see what the world has to offer with regard to information. That means alternative practitioners have a role too. The tragedy we have is that although we know a lot about how nutrition can reduce the risk of cancer and can help people survive, it's not really taught very much in medical school, where doctors learn about how to detect cancer, what to do with regard to treatment. What about chemotherapy? What about radiation? My question is, what about nutrition? Let's bring that front and center, because that gives women the power to improve their own health and protect their own health. When doctors approach patients with the possible benefits of a diet change, there are really 3 steps that are important. The first step is information. We've got to know what foods can do for us. That takes a few minutes of education, but most people are there. They want to put that power to work. Then the next step is to try out the foods that we're going to bring into our diet. So what we do at our clinic is we say, take about 7 days and think about foods that are really healthy. I mean, no animal products. Keep the oils really low. Vegetables, fruits, whole grains, beans. But which ones would you really enjoy? Okay, so oatmeal for breakfast, maybe with some blueberries on top. For lunch, instead of the meat taco, I'll try the bean burrito or the veggie chili. We're just taking a week trying. After about 7 days, you'll find lots that you like. Then the final step, put it to work. Actually have those foods, and I encourage people to do it all vegan all the time, 100% plant-based, for about 3 weeks. That's not so much that it's scary, but it's enough so that you're going to feel some benefit. And at the end of that time, you're physically healthier and your tastes are starting to change too. When it comes to alcohol, we really do need to take off that party hat once in a while. It turns out that if a woman has a drink of alcohol, if that's an everyday habit, her risk of developing breast cancer is substantially higher than if she doesn't have it at all. And it turns out that it's just the more you drink, the higher your cancer risk. If a woman's got cancer now, the first step is education. Learn about which foods are really in your corner. So that's the vegetables and fruits and whole grains and beans. And then think about the foods that they can turn into. You want to see how this is going to work out either in your kitchen or when you make your restaurant choices. And then put it to work. Test them out. See which ones you really like. And finally, ask your family or your friends to join you. After all, they're really your support system. They're also at risk too. And so if they change their diets, the likelihood of a problem happening to them drops as well. Genes do play a role in certain cancers, including breast cancer, but that's a rather small percentage of our cancer risk. The big part is lifestyle, and the biggest part of lifestyle is what's on your plate. So that's also the part that you can control. You can't choose your parents over again. You got the genes you're going to have. But on the other hand, you can choose what you're eating every day, and that gives you huge power. If a woman has extra body weight, more body weight than she wants, that extra weight increases her risk of developing cancer after menopause. And if she's got cancer already, that extra weight is going to mean her course is not going to be so good. Her survival is not as likely. So the reason for this, we believe, is that fat cells make estrogens, female sex hormones that can drive the growth of cancer. So what do? Don't go on a fad diet. Don't starve yourself. Don't go on a low carbohydrate ketogenic fad diet. Don't do those things. Go on a really healthy plant-based diet, because the vegetables and fruits and whole grains and beans have fiber. Fiber doesn't have calories. It fills you up and it makes you slim down naturally. Get away from the greasy foods. Don't have a big guacamole fest. Those fatty foods are going to keep the weight on too. But if you stick to plant-based foods, keep the fat content low, the weight comes off gradually. And not only does this improve survival and reduce the risk of cancer, you just feel better. You feel better in every way. Well, for people who are looking for more information, I hope you'll join us at the Physicians Committee for Responsible Medicine, PCRM.org. Our special website is letsbeatbreastcancer.org. And also, let me encourage you to have a look at my good friend, Dr. Christy Funk. She's known as the breast cancer surgeon for celebrities in Los Angeles, but she wrote a book that's wonderful. It's called Breasts: An Owner's Manual. And I've never heard of a better title for a book, I have to say, but it tells women what they really need to know. She's absolutely right.